So now let me introduce our panelists for the next conversation. First, we have Amy Ball, the CEO of Cook's Nook, Luke Saunders, who is the CEO and founder of Farmer's Fridge, Niyeti Shah, who is the Senior Manager of Social Impact at Weight Watchers International, Paul Newnham, who is the Executive Director of the SDG2 Advocacy Hub, and Beans is How. And moderating this panel, we have the amazing Dr. Karen Magid, Chief of Staff and Director of Sustainability and STEM at Huston-Tillotson University, who's been such an incredible partner and friend. Thanks. Over to you.
Thank you. Good afternoon. Hello. Well, I am excited for this conversation, and I feel like it's been such an interesting, inspiring day, like approaching things with a learner's mind and that curiosity. I'm really grateful to each of you for the work you're going to be talking about, because starting this conversation, sometimes I feel a little stuck. So just for a little context really quickly, here at Huston-Tillotson, we are Austin's oldest institution of higher learning and Austin's HBCU, and we're finding ourselves talking a lot about housing and trying to get really creative about how do we house our students. We have residence halls, but it's not enough. We want to grow a university. And we're an education institution, and we're having to get really deep into housing policy. And sometimes this conversation, I feel like, is very similar, where it's like, wait, why are we having to talk about health and healthcare and food? But that's where, so I'm really grateful for the work that you're doing and bringing a more nuanced perspective, and I'm really interested and really glad that everyone will get to hear about the work you're doing. So with that, let's start with Amy. Do you want to talk about the work you're doing and that connection point between food and health?
Yeah, absolutely. Thanks, Karen, and thanks everyone for having me. I'll just say very quickly, in case you think you're going crazy or ate something weird at lunch, I am not Joy Chevalier, who's above me. She is my partner in Impact, my business partner at the Cook's Nook, and she took ill, so I offered to step in. So if you know her, you know I have a big voice and an extraordinary brain to step in for, so I'm going to do my best. But super excited to be here and have this conversation. So the Cook's Nook is working at the intersect of food and health, particularly around designing food as medicine solutions. And what that means is we are making meals and food-related products out in East Austin in a commercial kitchen there, but customizing them to the needs of lower-income populations who carry the burden of chronic disease, and ensure that the meals are designed in a way that they both address the disease or the conditions that they're living with, but also feel familiar and enjoyable and are things that they want to eat, so that it ends up being the kind of food that they will enjoy, continue to eat, and then have the health outcomes that our partners desire. So that's how we're operating at the intersect of food and health, and we'll have more time to talk about that, and I'll pass it to Luke.
Hi, I'm Luke Saunders, the founder of Farmer's Fridge, which you guys had for lunch today. And if you traveled through the airport, may have seen one of our vending machines. But the entire reason we exist is to make fresh, healthy food as accessible as a candy bar. And if you had a salad today, you had 2 servings of fruits or vegetables in there. So we really look at fruits and vegetables are the one thing that if you can get people to eat more of, they're objectively going to be healthier as a result. And we don't consume enough of them in this country. So our whole mission is just make that easier.
Hi, I'm Niyeti. I lead social impact at Weight Watchers. And the connection for food and health for me is really interesting, because I think it's important to acknowledge that for a lot of us, we've been told that the connection of our food isn't necessarily there with health, because what is considered healthy oftentimes is a very exclusive Western version of what that means. And I know for me growing up, I went to a health class, came home and told my mom, this is it, we're gonna eat raw vegetables and salads, and this is how we're gonna be healthy. And she told me I was insane, which is super valid, but also that, the foods we grew up with are really healthy. It has a lentil, a vegetable, all of these things, but that was never what I was brought up to believe in school. And so part of my work at Weight Watchers, I oversee a clinical trial right now that we're doing with the Mid-Ohio Food Collective, partnering with a produce prescription program, but also offering this really tailored version of the Weight Watchers program that leans into, like, what are these foods that are available, how are we making them accessible, but also making sure that they're fitting into the cultural needs of the individuals that we're working with, and shifting that narrative about kind of what is healthy food and who gets to exist within that system.
Well, my name is Paul Newnham. I'm the Executive Director at the Sustainable Development Goal 2 Advocacy Hub, which looks at Sustainable Development Goal 2, which is part of the UN's 17 Sustainable Development Goals. And within that, we focus particularly around food, agriculture, and nutrition. And so when you look at that space, then you automatically connect food and hunger-related issues, but also with malnutrition and also our planetary health, and I think that's also a third area that needs to be a part of this conversation. But we run a number of different programs and projects across the world. One of them is with chefs, and we work with chefs to help connect the work that they do to the Sustainable Development Goals and help them to be able to connect the science with their actions and make choices that can really drive people into making the right choices that are delicious and really helping them in a holistic way. And then Danny mentioned the Beans is How campaign, and we've just launched a new campaign to double the consumption of beans globally in the next 5 years. And so that was launched last year at the Climate COP. And so we're doing a lot around beans, and particularly because beans and legumes are, you talk to any nutritionist and they just tell you they are absolutely essential for our diets. They provide soluble fiber, protein, macronutrients. And so there's also a lot of climate benefits, and also they're affordable. And so we're really looking at how do you bring those three together. And I had some in lunch today, so I was very excited by that.
We use a lot of beans.
We'll talk to you about that
for
later.
all those reasons.
Fantastic. Amy, I've been familiar with the Cook's Nook work now for several years, and it started as a culinary incubator. I'd love to hear about how the evolution has led to this point where it is this focus on like culturally appropriate foods that also address food and health in these specific ways.
Yeah, thanks for asking and calling attention to that. So we, as Karen said, we started as a culinary incubator. We have this commercial kitchen trying to support, in particular, minority entrepreneurs find their ways into the culinary space. So a really big mission around what we were trying to do. And then during the pandemic, like a lot of things related to food, that commercial kitchen got shut down because a lot of the businesses we were supporting didn't have somewhere to go. And we didn't want the kitchen space to go unused. And as I'm sure the folks here know, and you all might remember, if you can remember 3 years ago, at the very beginning of this crazy situation that we're in, there was a lot of food going to waste. It was coming in and not being used. So we ended up creating what was intended to be an emergency response to the pandemic, where we were taking the food in and we were creating healthy meals. And we were working with city and county governments to get them distributed through. We've worked now to date with 80 or 90 different organizations in this region who work with a variety of populations: homeless, first responders, single mothers, people who were in need and were either newly facing food insecurity or were existing and sort of feeling it get worse. And the response to that program is incredible, and some of the points have been made, partly because prepared meals is convenient. For a lot of the people who are low income, they're food insecure, they're working 2 or 3 jobs, they wanted to have access to a meal. It just makes it that much easier to eat something. Secondly, they thought the meals tasted good. They wanted to eat them. They were enjoying them. They felt better eating them. And then third, it was something that they felt like was important for the sort of cultural experience around food. So meaning that it felt representative of how they like to enjoy food, they could share it with their families. And so this has now become a 3-year project in the region, continuing to distribute these meals. And it started to attract the attention of organizations who were also engaged in health and issues related to that, but then also actors within the healthcare space. And then again, as a lot of the folks here on the panel can speak to, there's been some changes from a policy perspective that now allow healthcare organizations to pay for food as a benefit. The congressman that was up here earlier from the state of Oregon mentioned this. There are some changes being made And so it means that we no longer have to treat food and health as these two separate things as though they weren't related to each other, and we can actually unlock the ability for healthcare providers to create opportunities and pathways for people to not have access just to the medicines they need, but also to the food that's going to make it much easier for them to get back on track from a healthy perspective. And so we've been pulled into that, and we're leaning in because it's a really impactful way to get to the communities that we're serving.
Thank you. And Luke, I was wondering if there's anything, so you're also in prepared foods. I was wondering if there's anything that's resonating from that story, and if you'd share a little bit more about the development of Farmer's Fridge.
Sure. So we started 10 years ago. We started in a shared commercial kitchen, renting a table by the hour. And really at the beginning, it was trying to prove that people would buy a meal from a vending machine that wasn't total garbage, basically. 100 million people a day roughly go to a vending machine, so it's actually a really convenient way to get food to people. And that was really our premise, was if we could lower the cost to serve the food, we could make it cheaper and more accessible. And then it just happened to be healthy versus like pitching it as a healthy food concept. So if it tasted good, people would eat it. If it was cheap, people would eat it. And I think for us, the way that I think about the last 10 years is there's more and more willingness to subsidize healthy options, which we subsidize all kinds of things that we want people to do, and we charge more for things we want them to do less of. And so I think it's a very positive development for healthy eating in general.
Yeah, Niyeti, speaking of policy developments and shifts and this connection between food and health, the produce prescription program, would share more about that, and like how does that work?
Yeah, absolutely. So we work with the Mid-Ohio Food Collective with their produce prescription program. And so what that means is if an individual is experiencing food insecurity as well as another chronic disease, potentially experiencing obesity, they will go to Ohio State University or a number of other health clinics that they work in, and they will get registered for this produce prescription program. And what that program does is it gives them a certain dollar allotment to go to either a pickup site or a Kroger to purchase fresh fruits and vegetables. And one of the wonderful things about that program is they are allowed to select the food. So there's a lot of dignity built into it already, but also ensuring that people get that choice. And kind of where we come in with the health perspective is, acknowledging that a lot of times, sometimes the foods that are available in pantries aren't familiar to everybody. They aren't necessarily what fits into somebody's diet. And through the program, we've been able to create these community spaces where our members can share with each other, exchange recipes, start to talk about maybe how these foods can fit into what their version of health is, and really support each other both through like the healthy food experience, but also through the community and wellness experience.
On the global level, Paul, hearing that, can you bring to us some more information and more perspective, that global perspective on this?
Yeah, look, I mean, at the global level, it's quite challenging. So we have a world that produces enough food to feed the planet 1.5 times. At the same time, we have just under 900 million people going to bed hungry every night. We also then have this challenge at the moment of people not getting the right nutrients. And so if you look at that, there's a major impact. And there was a study that came out just last weekend that said by 2035, half the world's population will be overweight or obese. And if you think about that, we've got hungry people, and then we've got overweight and obesity. And so there's something in between that is really not hitting the mark. At the moment, this is because of access in many parts of the world. So there's 3.1 billion people can't access a healthy diet. This could be because of accessibility, or it could be because of affordability, or it can be because of both. Sometimes it's having access to the right kinds of foods. Sometimes it's affordability. It's being able to afford the right kinds of healthy foods. The other challenge that I think is a really big one is diversification of diets. And so if we look at where we get our calories from around the world, 60% are coming from 4 ingredients. We have 30,000 plus edible ingredients in the planet. The majority of our diets don't even touch 150. So we are using the way we solved some of our hunger challenges or our supply challenges was by producing food more efficiently and effectively, but reducing the diversity of our diets. And if we have a very focused diet, then there's just natural that you're going to get less nutrients, you're going to get less of the health. And so promoting forgotten foods, biodiverse foods, whatever you want to call them. You know, Pierre was talking about funio earlier today. Millets, it's International Year of Millet, so the whole millet family has, you know, a lot of nutrients. Beans, all of these kinds of groups. Getting people excited about that is something that's really critical. And it's critical when I hear what's going on here in the US. For the US, which is often a trendsetter, you know, dietary guidelines have a big impact on other groups' dietary guidelines. And I know there's lots of work going on in that space. So how do you influence then that diet diversity, looking at preference to things that are nutrient dense and that also, I would say, have planetary impacts, so that produce with less water in more efficient ways that are good for the soil. And I think if we get that right, then we can start to really impact people's health.
Can I just add to, I just want to pick on the point about accessibility, because I just want to make sure when we talk about that, we're not talking just about physical access, because that was coming through in your comments as well. Accessibility is physical access, but it's also time and it's education. If you think about the state here in the US, for example, 4 in 10 US adults has a chronic disease, 6 in 10 have a chronic disease, 4 have 2 or more. So this is a huge population of people that we're talking about, and it's not just physical access to a good food supply that's limiting them. It's about time, it's about convenience, it's about affordability, it's about education. So I just want to bring that, when you're thinking about these issues, a lot of people tend to think like, oh, if we build a grocery store or make food more accessible, like by having a physical location, that's part of the way. You have to meet the communities where they are, and so understanding those other dimensions is really important to solving this issue.
Yeah, and look, I know we talked about that a little bit in our prior conversation about, diversity and different communities. What does that bring up anything for you?
Yeah, I mean, so we very intentionally use the word as accessible as a candy bar, because it is, you know, convenience. Is the food approachable? Is it the right price point? Does it save you time? So we kind of look at the full dimension. In terms of where the fridges are placed in our customer base, one thing that we try really hard to do is actually be affordable. And so half of our customers actually make less than $70,000 a year. We over-index on low-income customers in Chicago, where we have the most data. And so it is actually, like, from what we measure, that's the main thing that we look at, is like, is this a product for people who make an average income in the United States, or is this something that's like exclusively for people who can afford it? And we really push our team, and that's a big reason why we have the model that we have. So we make all the food in a centralized kitchen. We only have 25 SKUs, so we're constantly optimizing the product mix, and even looking at things like, how do you add different ingredients that can bulk up the protein, or but also reduce the cost. So yeah.
Yeah, the data question, I was curious if, what are the types of data that you're using, you know, you mentioned how it would qualify into the program. What type of outcomes are you using?
Yeah, that's a great question. One thing that is really exciting about the program that they're running is the outcomes kind of span the gamut. So we're definitely looking at, you know, really specific health outcomes. It is a produce prescription program. We work with healthcare. It is, you know, healthcare cost savings that we're looking at, percentage of body weight loss, some of those really traditional outcomes. But one of the outcomes that we're most excited about, that we're already seeing, is looking at things like the feeling of inclusion. Are you adhering to your medication better? We're seeing that participants in the program end up getting their produce more regularly because these workshops happen at the place of pickup. And we're also seeing some really exciting benefits around mental health, as well as like really key quality of life things. There's a member we have who, for the first time, was able to walk all the way to work without taking a break. And for her, that was the motivator, right? It's not always, I think, like, I want to lose weight. There's so much more to that. And so it's really exciting to, you know, build this connection between food and health, but have people realize there are real life impacts that can be really motivating for it, and bring that kind of back home. I think something we've talked about that is really cool about your program is it makes it convenient and it's meeting people where they are. And so I think along with these changes, part of the narrative shift has to include that. Like, are we really building an inclusive movement where we're meeting people where they are, but prioritizing the goals that they have and helping them get there?
I want to expand upon that. If we're starting to build up to the systems level, I think it was just mentioned. I was looking at my notes from the last panel. Rupa Maria mentioning like a couple of things, like, okay, so innovative solutions. How do we get to that systems level? And Paul, starting with you from the global perspective, like, what are the policies? Like, what's next? What else do we need?
Yeah, I mean, I think the starting point for thinking about the system is to actually acknowledge that it is a system. And I think that too much of our work is thinking in parallels, and it's an or. We often think about, should we do this or should we do that? And even the way this question's framed around food and health, it has to bring in environment and planet. You just can't connect the two, because soil health is so critical to the quality of the ingredient, the macronutrients, the way that the ingredients are going to actually interact. And so we have to think about this in a much more holistic way. And so for doing that, that's really challenging, because the way that we structure even our governments in many parts of the world, they disconnect this. So you have health, you have agriculture, you have, often the kind of social services dealing with hunger, and they're very separate. And I think until we start to bring that together, and there are countries that are doing this, where they are starting to bring together ministries together, and the UN Food System Summit that was held a couple of years ago was really helpful in getting countries to come up with food system strategies and plans. But we have to be thinking that way about food, and we have to bring that then down to our local food strategies, to the way that we're understanding where that access is, the education and all of that. But I think there's just that the simple things we can do are really about understanding what motivates the majority of food choice, and it's cost, convenience, and taste. And if you get the cost wrong, if you get the convenience wrong, and you get the taste wrong, these are big drivers for how people make choices. And so we have to think about, how do we work within them to drive choices which can help deliver the outcomes that we want. And I think diversified ingredients, to me, having seen many things all around the world, encouraging people to try different ingredients, getting more different things. Like if you saw lunch, you saw there was like a whole range. We had, quinoa, black beans, corn, cabbage. There was getting that on a plate and getting that into your ingredients. If you're making, packaged foods or whatever, just think outside the box and try and bring that in, because the more we do that, the more chance people have for getting those macronutrients.
Amy, how is the Cook Nook approaching this type of, you mentioned, culturally relevant foods and also geared with health, but, is there a way that you're also approaching this, like getting new foods into diets?
Yeah, I think a lot of what Luke and Paul have talked about is very similar to how we're sort of approaching the design of our menus. I think the additional level that we're considering is that we're interfacing with populations who, through the partnerships that we have with organizations in either the healthcare or the government space, we have knowledge about what are their sort of health conditions that they're facing. So for example, one of the populations that we've had some conversations around are people that struggle with kidney disease, which is really prevalent in the United States. Something close to 100 million people have it in this country. If you gave someone with kidney disease a banana and an avocado, for example, and said, great, here's some healthy food, there's a problem, because both of those things are high in potassium. It's actually not good for their condition. So we have to take in that additional level of knowledge. Actually, on the next panel here at Food Tank, you're going to hear from Adrienne Lipscomb, who is also the culinary director at the Cook's Nook, and she's going to talk a lot about foodways. But part of the knowledge that she brings is helping us think through, like, how do we customize our menus, customize our meals to be tailored to. There's a whole an area called medically tailored meals, and it is exactly what it sounds like, meals that have been tailored to help you not only be healthy, but also sort of counteract the effects of whatever health conditions you might have, and that's sort of the additional sort of dimension that we're bringing to our work.
Oh, fantastic. Thanks. I know we're starting to get close to the end of our time, so I want to also make sure there's an opportunity to talk a little bit more about policy and sort of what else could be needed. And Niyeti, especially from you, starting with you, what else could you see us supporting the work that you're doing? You said you're working with the Ohio Food Collaborative Collective. I'm going to mess that name up, but are there more? How are the next conversations going about what this could look like from a policy level?
Yeah, I love that question because that's really the goal of this program is if we can make this work, if we're seeing the impact, what pressure are we putting on the system to make this replicable in other places? And so with the Mid-Ohio Food Collective, right now we're looking at, is there a way to partner with Ohio State to bring this to their additional sites to provide this type of community service to other locations? And we're also talking to about 3 or 4 other food banks across the country who run produce prescription programs to see, can we replicate it in different populations, but also acknowledge that those programs will likely look a little bit different. And that also includes things like looking at in lieu of services and 1115B waivers and these flexibilities that are now available within Medicaid to pay for these services at the state level. And I will say, you know, as one of the big corporates here on the stage, I also think a huge part of it is recognizing that corporations who exist in the food space have to take policy action. Like, we have to be standing up and pushing for these policies at the federal level. And so we're excited to use this as a test case to start to figure out where else can we kind of keep pushing this forward and really push that food is health narrative.
I'll just add as well, just because the Medicaid point's a really important one. So if you're here in Texas, if you're based here in the state, there is a bill right in front of the Texas legislature called Healthy Food is Good Medicine. And it's representative of, I think there's now 10 states or more across the country that are either have made changes to Medicaid or have used the 1115B waivers to make changes to allow Medicaid to pay for food as a benefit, which is really critical. And so if you can advocate with your local representatives, you can take this back home to the states that you're in and either promote the same legislation or work to sort of amplify the things that are already happening there. But that's a space that I would pay attention to, because finding the funding for this is also really critical, and this is a really big tool in this country to do that.
Thank you. I want to end with an opportunity for everyone to share, you know, what's next, what are the challenges, just what do you want the audience to know here and online, and especially that, you know, how do we engage with the different, you know, perspectives and programs you're coming from?
All right, I'll go. I'm not shy. Like Niyeti, we are also working on doing pilot programs. So part of what we need to do as an organization, and that's happening again across the country for people who are really committed to serving the communities and seeing health outcomes change for the better, is demonstrating to payers, to the organizations that care for these individuals, that providing food as a benefit can lead to those outcomes. And that's important for these organizations, because leading to those better health outcomes also means that they're getting greater patient engagement and usually reducing cost of care, and so they drive really big business incentives as well. And so we want to continue to see more work like that.
I think for me, I've been doing it 10 years, and we're kind of just getting started. So we have 1,000 locations between fridges and our retail stores, and I view this as something that might take, you know, based on what we've accomplished in the last 10 years, we might be 1% of the way to where we want to be in terms of the impact we could have if everybody was eating as many Farmer's Fridge meals as they were our cheeseburgers every day, which is some crazy number, like 40 million people will go to a fast food restaurant today. So that's what I think about a lot, and I think the thing that would be very helpful is putting more money behind healthy food and working on how you define that. But it's a very difficult industry to get funded. That's even harder now. It's low margin, it's hard to execute, and so anything that can be done to make the sector more attractive for outside investment, I think would be very impactful.
I have 2. So my first is, if you are working at a food nonprofit or if there is one in your community, come find me. We are trying to grow this program, and I would love to have that conversation. And the second is, you know, if you have an opportunity to advocate for a more inclusive food movement, particularly as it relates to food and health, like please do so. That can be talking to your local organization about, are there cultural foods there? That can mean donating really high quality cultural foods to your local food bank. But wherever you get that chance to really push that inclusive narrative, that would be my biggest ask.
I think for me, the biggest thing we need to realize is we're running out of time. In many people and many communities, we have run out of time, and bad food is causing major health issues. I was talking to a friend who's a nutritionist. She was telling me it was 3 or 4 out of the main causes of death are food related, the top ones. And so I think we need to act fast. We need to, there's no one size that fits all, but there are things that we know and that everyone kind of can agree around that we should be doing. And so I think it's getting behind those things. And I would say at a broad level, diversification of diets, if you're looking at that at all different levels, that's a thing that we can all be doing. How we then think about certain food groups, which everyone kind of agrees, from the farmer right through to the nutritionist to the doctor, get behind them. So, you know, Pierre was talking about funio. There's going to be a whole thing on blue foods. Beans is something we're passionate about, and we believe, you know, stand up for themselves in terms of any interrogation, but getting that diversity out there and talking about that in the conversations that we're having at all the levels. But then also just remember, food's got to taste good. We eat not just for health. And so it's far more than just about health. It's also about enjoyment, culture, life. And so this has got to be something that we embrace and that's enjoyable.
I think that's a perfect place to end. I'm so glad that we got to that we eat for so many reasons, and health is a critical piece, but it's so complex. So let's thank our panelists.